Hi, my name is Dahlia Lawanig, and today I will be talking about urinary tract infections in both men and women. In week 13 of the series Catch Me If You Can, we've discussed about some of the normal bacteria that is found all over our body. Escherichia coli, also known as E. coli, is one of the main bacteria found in our gut flora. However, if found in the bladder, it can cause urinary tract infections. This is relevant to our class because we have been working with E. coli many times in the lab. As you know, we have a symbiotic relationship with this gram-negative rod. We can find E. coli in the intestines and where it helps us with our gut microbiome. But when we find E. coli anywhere else outside of the intestines, it can cause serious discomfort and diseases to the individual. So what is a UTI? UTI is an acronym for urinary tract infections, and it is also known as cystitis. Cystitis is the medical term for inflammation of the bladder, which is a result of urinary tract infections. When the E. coli bacteria enter the urethra, it can travel into the bladder, prostate, or kidneys, which can cause the bladder to become inflamed. As a result of this inflammation, people may feel an urgency to urinate, but upon urination, not a lot of urine may come out. So what are the symptoms? Some symptoms may be associated with UTI, such as strong and frequent urge to urinate, cloudy, bloody, or strong smelling urine, pain or a burning sensation when urinating, nausea and vomiting, as well as muscle aches and abdominal pains. Doctors can test for UTIs by ordering a urinalysis to determine if any bacteria is found in the bladder. Some treatment for UTIs are antibiotics such as ampicillin, cetraxone, levofloxacin, or cenfalexin. Any of these antibiotics can be prescribed and taken orally. There's an interesting fact that I'm a caregiver and one of my patients have reoccurring UTIs, and one of the treatments that she had to undergo was getting a catheter and being injected an antibiotic solution inside of her. I found this interesting because we have previously talked about catheters that cause or can cause UTIs, and I found it ironic that she would get a catheter placed inside of them so she can have the medication inserted in her through her catheter. Some preventable measures include proper wiping techniques for women, so women would wipe front to back, and using a new tissue each time after each wipe. Some other measures include showers rather than bathing or baths because the water can be contaminated with other bacteria. Individuals should also wear breathable clothing such as cotton undergarments and refrain from using deodorant sprays, douching, or other harmful feminine products. It is also encouraged to drink plenty of water and to wash up before intercourse and urinate after intercourse. So these are some of my references used, and I hope you learned something about UTIs. Thanks!